Hi, my name is Jackie, and I'm going to be your student nurse today. Can you tell me your name?
Kelly,
Can you tell me your date of birth?
2289
All right. Can you tell me where we are today?
at the hospital.
Okay. And what month is it?
November,
And who the current president is?
Trump,
All right. Glasgow Coma score of 15. Patient appears well groomed and sitting erect in her chair. Are you having any pain today?
no,
Okay. So on a scale from 0 to 10, 10 being no pain, I'm sorry, 0 being no pain, 10 being the most pain, what would you score?
0.
Perfect. Patient's vital signs are 120 over 80, heart rate is 80, temperature is 98.6, her respirators were 16, and her SpO2 is 98 on room air. Can you tell me what you ate for breakfast this morning?
I did not eat breakfast.
Perfect. And can you tell me what you did on the day that you graduated high school?
We walked across the stage, and then I got my diploma, and then I ran.
Right. Okay. Speech is clear, coherent, and relevant to the subject. All right, Kelly, now what I'm going to do is I'm going to test your eyes. I'm going to shine this in your eyes and look to make sure that your eyes constrict. They're both constricting. Now, if you can look at my nose, look at my nose and then look at the clock and then look back at me. And they accommodate. So now what I'm going to have you do is stand up and put your feet together. Feet together. All right, now close your eyes. I monitor for swaying back and forth. Okay, we are done for 20 seconds there. And now I'm going to assess your gait. So I would like for you to take a couple steps this way to the wall and then walk back that way. Perfect. Thank you. You may have a seat. Gait was fine. No problems there. So I'm going to test your muscles, tone, strength, and coordination. So what I'm going to ask you to do is stick your arm straight out. And I would like you to pull up against my resistance. Perfect. And now push down. Perfect. And I'm going to use your feet here. I want you to push like you're pushing on a gas pedal. Great. And now push up against. Okay, perfect. I'm going to cross my arms here, and I want you to grip my fingers and squeeze. Okay, perfect. Those are equal in both hands. And what I'm going to do is have you close your eyes. I'm going to test your sensation. So tell me if you feel something that is sharp or dull.
Dull. Sharp.
Okay, now I'm going to do,
Soft on my right hand.
okay,
Sharp on my left arm. Sharp on my right foot. Soft on my left foot.
okay, perfect. You can open your eyes. Now I'm going to use your foot, and what I'm going to do is, actually I use my pen. I'm going to swipe down the right side, swipe down the left side, and across the bottom, and I'm going to assess her toes. They did not flare, so she has a negative Babinski reflex. And now I'm going to do some cranial nerves. What I'm going to do is I'm going to assess your first cranial nerve, so I want you to close your eyes. I'm going to put something underneath your nose and have you smell it, and you tell me what it is.
Peppermint.
Yes. All right, and then I'm going to take my finger and I'm going to touch your nose with your eyes. Follow. Thank you. Okay, so then I'm going to test your eyes also for, this is cranial nerve number 2. I did number 3 in reverse. Cranial nerve number 2, I'm going to have you look at my nose, and I'm going to put numbers in your 4 visual acuity spots, and you tell me what they are.
2, 2, 1, 4.
Perfect. All right. So what I'm also going to have you do now is take your eyes and look down and then in. Okay. So number 5 is where I'm going to have you hold your mouth open, and you hold it open while I try to close it. Okay. And then close your eyes and you tell me where I touch your face and with what you feel.
Soft on my left cheek. Soft on my right forehead. Soft on my chin.
Perfect. So then I'm going to have you follow this. I want you to keep your head still, but with your eyes follow my pin. All right, that's awesome. Okay, so cranial nerve number 7, I checked for your symmetry on your face, so I need for you to smile for me. Good. Raise your eyebrows. And open your, okay, so I'm gonna touch your eyes. I'm gonna try to open your eyes, you keep them closed. Okay. So number 8 is the acoustic. So I'm going to stand behind you and say something, and you tell me what you hear.
Yes.
What did I say?
Can you hear me now?
Okay, over here.
My favorite color is blue.
Perfect. So number 9 is the glossopharyngeal, and number 10 is the vagus, but you can test them together. So what I'm going to do is take this tongue blade. I'm going to have you open up, and I'm going to touch this to the back of your throat. And say, ah. Okay, so number 10 is where she said ah, and I assessed her soft palate on both sides of her eyes equally. So then number 11 is I'm going to place my arms on your shoulders and have you shrug against resistance. Perfect. Now I'm going to place my hand here and against resistance, turn your head. Perfect. And this side also. Good. Okay. And then cranial nerve number 12 is I'm going to have you stick your tongue out at me and move it from cheek to cheek. Perfect. No tremors noted. Thank you very much, Kelly.